Hello, I'm Dr. Shahzad Waseem, and my this talk, small talk, is on myths in ophthalmology. One of the myths, and very important, is that when somebody has got headache, he is sent by general practitioner or almost everybody to the ophthalmologist, and they ask that person to get his visual acuity or vision get checked. So I want to clarify that there is no relation between the headache and refractive errors. Hardly if there is any relation that is of small fatigability or asthenopia, as I told you in the cases of hypermetropia. Otherwise, only 5% of the cases of all the headaches are related to the eye, and the pain, uh, if the patient is feeling the pain in the eye and eye is not having any disease, most probably it is a referred pain from cervical lesion or sinuses, etc. The second myth is that when some child develops a habit of watching the television from a close distance, it has been seen that his mother goes and pulls his child back and asks him to watch the television from the proper distance. In fact, it is other way around. You should inquire why the child is approaching the television because he wants to see clearly from the distance from where which is a normal distance and from where the mother wants the child to watch the television. He is not been able to see clearly. That's why he is crawling and moving towards the television. So there is a high possibility that the patient is nearsighted or he is having myopia. So instead of abusing the child, it is better to get him checked by an ophthalmologist to rule out any refractive error, especially myopia. Another myth, if you read in dim light or if you read while you are lying in the bed or if you are reading a very small prints, then you will develop refractive error or decrease in the VN. Usually, there are slight decrease in the VN. All these factors can cause symptoms of eye strains like fatigability, which we call asthenopia, mild headaches also. Blurring of VN can be caused, but none of these activities cause actual eye problem. But it is recommended that you should read and write or any activity which you are doing, you should do in a proper posture, and it is recommended that you do write or uh, read using the table lamp, especially if you are above the age of 40 years, where the sensitivity of the retina is decreased. Uh, these are these were the few important points which I had in my mind, and I talked about it. You leave your comments in the uh, comments box. Leave your suggestions, your questions. I will try to respond to them as soon as possible. Thank you very much for watching this video. I am intentionally making the videos very small so that they don't become boring. And please subscribe to this channel because this is my second channel which I have made exclusively just for learning the ophthalmology. The other channel is not used only for ophthalmology. There are and other purposes also which for which that channel is used. So please subscribe to this very channel. Thank you.